Hello everyone, my name is Joyce Torsu and I'm presenting on opioid use crisis in Massachusetts. Is opioid abuse. Opioids are a class of substances primarily used to treat moderate to severe pain by inhibiting the transmission of pain in the nervous system and producing strong analgesic effect. Opioids can be prescription medication, illicit drugs such as fentanyl, morphine, codeine, tramadol, and heroin, among others. Opioid use disorder is also the chronic use of opioid and outside of medical guidance. They cause euphoria leading to addiction. How did the opioid crisis begin? In the United States, it begins with three distinct major waves. The first wave in the 1990s began with increased prescribing of opioids for pain management after pharmaceutical companies promoted them as safe and non-addictive. Wave, which began in 2010, was the rise of heroin use in prescription opioid and began from 2013 till present, began with increased deaths involving synthetic opioids, especially fentanyl. How common is the opioid abuse in the United States? From 1999 to 2021, nearly 645,000 people died from an overdose involving any opioid, including prescription and illicit opioids. Among U.S. adults, approximately 1 in 3 reported using prescription opioid, and 4.7% of adults were estimated to be misusing opioid. According to the 2017 National Survey on Drug Use and Health, 7.1% of between the ages of 18 and 25 and 6.9% of those between the ages of 26 and 34 misuse opioids. This caused the national public health emergency. Most at risk for opioid abuse. Risk factors are for individuals who have used opioids for a long time or high doses, such as patients with chronic pain, prior substance use or family history of substance use, patients who have mental health disorders such as depression, anxiety, or PTSD, social determinants of health such as poverty, unemployment, and adverse childhood experiences, and then patients with high risk behavior such as alcohol use. Side effects of opioid use. Short-term effects include pain relief, euphoria, drowsiness, confusion, nausea and vomiting, constipation, and sedation. Long-term effects include physical dependence, opioid use disorder or addiction, depression, and anxiety, increased risk of infectious disease such as HIV or hepatitis, cognitive impairment, and increased rise of overdose deaths. Signs that suggest opioid abuse. Physical indicators: constricted pupils, drowsiness, slurred speech, injection marks, poor personal hygiene, and withdrawal symptoms. Some behavioral indicators include multiple opioid prescription, social withdrawal, mood swings, declining performance, and financial problems. There are also co-occurring mental health conditions such as depression, anxiety, PTSD, and psychotic disorders. Can opioid cause overdose or be used in suicide? The answer is yes. Opioid use disorder can cause an overdose, which is fatal. They can be unintentional due to potency of the drug. They can also be intentional and represent self-harm and suicide attempts. Common symptoms include respiratory depression, pinpoint pupils, blue lips or fingernails, choking, or loss of consciousness. Treatment options for opioid use disorders. Class is methadone, which is a full agonist that stabilizes the patient and prevents withdrawal and cravings. The next one is buprenorphine, which is a partial agonist that lowers the risk of respiratory depression. The third option is naltrexone, which is an antagonist that blocks opioid receptors entirely. The patient must be fully detoxed before initiation. Our non-pharmacological treatment options are cognitive behavior therapy, motivational interviewing, contingency management therapy such as group and physical therapy, and then support groups. What patients should know about opioid abuse. Patient education is critical for engagement and safety. First, providers must help patients understand that OUD is a chronic disease, not a moral failing. Like diabetes, it requires ongoing management and treatment, not willpower to lead to recovery. Patients need to understand the different medication available for them and the prescription they have. Medication for opioid use disorder. Illicit produced by up to 90%. Patients must understand the medications need to be stopped gradually and not abruptly to reduce the risk of relapse and fatal overdose. Every patient and their family should be trained on naloxone administration and how to recognize an overdose. Education on relapse prevention should include identifying common risk factors such as chronic diseases, just treatment, not as a personal failure. Diedick et al. 2024 recommend having a crisis plan strategy. Identifying triggers and having a plan is essential. Lastly, patients need to understand harm reduction strategies. For example, and Strain 2022 recommended using fentanyl test strip to check for contamination. Other Dyke et al. Recommend avoiding alcohol, benzodiazepine, and other CNS depressants while on opioids, and using safe injection practices to reduce infectious disease risks. Lifestyle changes and major points management. What else can be done? OUD is a complex condition that often requires a multidisciplinary approach. It is important to refer patients to an addiction specialist for complex medication management and to mental health providers to treat co-occurring conditions like depression, PTSD, or anxiety, which are highly prevalent in this population. Patients with chronic pain may benefit from pain management referral to develop non-opioid relief strategies. Social workers or case managers are invaluable for helping patients navigate housing instability, unemployment, and legal problems, which are common social determinants of health affecting recovery. Patients also need community resources such as SAMHSA helpline is a free 24/7 resource for finding local treatment options. Harm reduction services such as needle exchange program help reduce the spread of infectious diseases and can serve as a bridge to formal treatment. Preventing opioid use disorder. In Massachusetts, the Massachusetts government provides a list of resources available for residents in its website that patients can refer to. Opioid Toolkit, a local public health toolkit for addressing opioid use. Follow-up is very important. Weekly, bi-weekly follow-ups helps monitor parameters, substance use, withdrawal symptoms, mental health status, and it also helps the provider to assess treatment outcome and consider long-term care. To close, opioid abuse is a public health crisis of tremendous scale. Of abuse are distributed across individuals of all ages, with some factors increasing the risk of abuse. The consequences of opioid abuse include immediate danger like respiratory depression and long-term effects, including addiction, cognition impairment, and infectious disease. But most importantly, OUD also carries a high burden of co-occurring mental illnesses with depression, anxiety, and PTSD affecting a significant portion of this population. Important for patients, providers, and community members. Early recognition saves lives. There are effective treatment options available, including medications such as methadone, buprenorphine, and naltrexone. Comprehensive approach includes combining pharmacological and non-pharmacological treatments. It is important to note that opioid use disorder is a chronic, however, it is treatable medical condition. The goal is not to prevent death, but to restore health and dignity and quality of life. Thank you for listening.